Hello, I'm Dr. Steven Sparagana, and I work very closely with pediatric patients who have TSC. Now I'd like to share my experience with you. Imaging can confirm the presence of brain lesions associated with TSC, such as SENS, tubers, and SEGAs. Hydrocephalus causes increased pressure in the brain and can be life-threatening. Classically, the testing that defines brain involvement would be an MRI of the brain or a CT of the head. MRI and CT use computerized imagery to show detailed images of the body. Specifically, an MRI shows internal body tissues, and a CT may be used to create a three-dimensional image of a body structure. Depending on the stage and circumstance at which an individual presents, a CT may be performed before an MRI. There are different situations when a patient would get a CT instead of an MRI and vice versa. I've noticed this may occur when somebody has their first seizure and is in the emergency room. The medical team wants to rule out a stroke, bleed, or something serious of that nature. That's why these patients will often get a CT scan instead of an MRI, because they can get it quickly and may not need sedation. However, MRI would be the preferred method of study. That's because tubers often are not apparent on CT, whereas MRI is a better imaging modality for showing tubers. When neurologists image SEGA, it's important to know how the lesion is behaving, so to speak. If there is evidence of hydrocephalus, the patient is at a critical point. I also factor in the age at which the patient presents with SEGA. Overall, I think neurologists are pretty well attuned to the nature of TSC and the potential issues. If imaging suggests hydrocephalus, I believe most neurologists jump on that right away.